Diabetes and the influence of diet. Diabetes is a health condition that affects millions of people worldwide. It is a chronic disease characterized by the body's inability to effectively regulate blood glucose, sugar, levels. Glucose is an essential source of energy for the body, but its improper regulation can lead to serious health problems. Diet plays a fundamental role in the control and management of diabetes, as the foods we consume have a direct impact on blood sugar levels. Understanding diabetes. There are two main types of diabetes, type 1 and type 2, along with other less common types such as gestational diabetes. Type 1 diabetes is an autoimmune condition in which the body destroys insulin-producing cells in the pancreas. Insulin is an essential hormone that allows the body's cells to absorb glucose from the bloodstream. As a result, people with type 1 diabetes require regular insulin injections to survive. Type 2 diabetes, on the other hand, is more prevalent and is often related to lifestyle factors such as an inadequate diet, lack of physical activity, and excess weight. In this case, the body's cells do not respond properly to insulin, or the pancreas does not produce enough insulin. Type 2 diabetes is often treated with dietary changes, exercise, and in some cases, medications. If you're in need of a supplement that helps you lower your blood sugar levels, I'll leave you a link to a product that can help you. It's in the commentary attached to that video. The role of diet in diabetes. Diet plays a crucial role in diabetes management because the foods we consume are the primary source of glucose in the blood. Here are some ways in which diet influences diabetes. 1. Blood glucose control. Carbohydrates. Carbohydrates are the main source of glucose. It's important to choose complex carbohydrates like whole grains that release glucose more gradually, avoiding sudden spikes in blood sugar levels. Fiber. Foods rich in fiber, such as vegetables, legumes, and whole grains, help regulate blood glucose by slowing down glucose absorption. Fats and proteins. The proper balance of healthy fats and lean proteins also plays a role in stabilizing blood glucose levels. 2. Weight management. Maintaining a healthy weight is essential for controlling type 2 diabetes. A balanced, calorie-controlled diet can help prevent or manage excess weight, which, in turn, improves insulin sensitivity. 3. Prevention of complications. A healthy diet for diabetes can help prevent long-term complications such as heart disease, kidney problems, nerve damage, and vision issues. 4. Insulin level management. Some foods can directly affect insulin production and sensitivity. For example, high glycemic foods like refined sugars and processed foods can cause rapid blood sugar spikes, requiring more insulin. The best foods for diabetics. Diet plays a vital role in controlling diabetes, whether it's type 1 or type 2. Choosing the right foods can help keep blood glucose levels within the target range, promote a healthy weight, and prevent long-term complications. Here are some of the best foods for diabetics. 1. Non-starchy vegetables. Vegetables such as broccoli, spinach, kale, zucchini, carrots, bell peppers, and leafy greens are rich in fiber, vitamins, and minerals. They are low in carbohydrates and do not cause blood sugar spikes. You can include them in almost every meal. 2. Whole grains. Whole grains like oats, quinoa, brown rice, and whole wheat bread are high in fiber. They release glucose into the bloodstream more slowly, avoiding spikes, and provide essential nutrients while keeping you feeling full. 3. Legumes, lentils, beans, chickpeas, and peas are excellent sources of protein and fiber. Like whole grains, they have a lower glycemic index and can help control blood sugar levels. 4. Lean proteins. Fish, skinless chicken, lean meat, and tofu are great sources of protein without excessive carbohydrates. Protein aids in satiety and muscle building. 5. Healthy fats. Unsaturated fats found in avocados, nuts, chia seeds, and olive oil are crucial for cardiovascular health. They do not significantly affect blood glucose levels and provide long-lasting energy. 6. Fruits in moderation. While fruits contain natural sugars, fructose, many of them are high in fiber, which reduces their impact on blood glucose. Fruits like apples, pears, and berries have a low glycemic index and can be consumed in moderation. 7. Low-fat dairy, skim milk, unsweetened yogurt, and low-fat cheese are good sources of calcium and protein. They can be included in a diabetic diet in moderation. The worst foods for diabetics. Avoiding certain foods is equally important for diabetes management. Here are the worst foods for diabetics. 1. Added sugars, sugary foods and beverages such as sodas, cakes, candies, and concentrated fruit juices should be avoided. They cause rapid spikes in blood glucose and can lead to instability. 2. Processed foods. Highly processed foods like fast food, chips, and ready-made meals often contain excessive refined carbohydrates, sodium, and saturated fats. These foods can disrupt blood sugar levels. 3. Refined carbohydrates. Avoid foods made with white flour, such as white bread, refined pasta, and sugary cereals. They are quickly digested and can cause blood sugar spikes. 4. Foods high in saturated and trans fats. Fried foods, processed meats, such as sausages and bacon, and trans fat-containing foods should be avoided as they are linked to heart issues and can hinder blood sugar control. 5. Excessive high glycemic fruits. While fruits are generally healthy, some like grapes and watermelon have a high glycemic index and can rapidly raise blood sugar levels. Consume them in moderation and balance with low glycemic options. 6. Excessive alcohol. Alcohol can affect blood glucose levels. Excessive consumption can lead to hypoglycemia, low blood sugar, or hyperglycemia, high blood sugar. If you choose to drink, do so in moderation and always with food. 7. Large portions. Controlling portion sizes is crucial to avoid blood sugar spikes. A balanced diet with controlled portions is essential for diabetes management. Remember that each person with diabetes may have different dietary needs, and it's important to work with a healthcare professional or nutritionist to create a personalized meal plan. Additionally, regularly monitor your blood glucose levels and adjust your diet as needed. A balanced and consistent approach is the key to successful diabetes control.